Hi everyone, good afternoon to you all. I want to thank everyone for joining our Easter Live session today. I had a special guest, a medical practitioner, a fertility expert, Dr. Yemisi Adeyemi. I call her Dr. B. She's the MD of Art Fertility Clinic here in Lagos, Nigeria. And today we talked about fertility issues affecting couples in terms of delay in conception. And it's a very sensitive subject. And of course, there were questions, So what I can say really is that Dr. Bero will definitely be coming up again because I think there are a lot of issues when it comes to infertility, and we can't just discuss it in 1 hour. So definitely I'll be bringing her again, and you can decide what topics you want her to cover, whether you want her to cover on IVF or other assisted treatment, or the different issues as it concerns women and men. So I just want to quickly do a recap, everyone, for those who were not able to join, and please, it will be on my Easter Live story for another 24 hours. So if you want to watch it, please go ahead and do that. So the first question I asked really is for her to explain what infertility is, because there's obviously a relation with infertility and delay in childbearing. So for what she said, and I want to quote it, is that if you've been trying for over 6 months, you've been having unprotected sex, and you've been meeting at the right time in terms of your ovulation time, and you haven't been able to achieve pregnancy, then you need to consult an expert, right? So normally they would say over a year, but Dr. Bero advises that once it's over 6 months, especially if you're over 35 years as a woman, you need to take the action fast once you're over 35 years, because the earlier the better you report and you do your examinations, the better for you. If you wait longer, it also decreases your chance of conception. So that's what she explained in terms of fertility. Now, I asked her about what the causes of infertility or delay in childbearing. Now, she explained that there could be different causes. For women, you could have things like ovulation, irregularity in your ovulation, so you're not producing the right egg quality and quantity, and that can be due to age. It's an age factor, could be one of them. Sometimes it's not even age. If you're not having intercourse at the right time, so if you're not having it during the right time of your ovulation. She also explained the ovulation time and the different kits that can be used to monitor ovulation, so that you're sure that you are doing it at the right ovulation time, because those are some of the factors that are important. She talked about endometriosis, and then she talked about fallopian tubes. If your tubes are blocked, even though you can still, if you have one tube and you've been trying for over 2 years and nothing is working, please see your doctor, fertility expert. She talked about the lining of the womb, which is also extremely very important. If you have fibroids, these are also things that can affect your conception, polyps, cysts, and then there's something she called congenital uterus. So that's how your uterus is abnormal. And some people, I understand, are even born without uterus, but they have ovaries. So and then she also talked about autoantibodies. So these are antibodies that prevent you from conceiving because they are fighting the fetus. So a lot of factors when it comes to women. For men, she talked about semen abnormality. She talked about semen density, semen count. So you have to have a particular count for you to achieve pregnancy. She talked about ejaculating but not having any sperm in it. So when you ejaculate, sometimes you don't have sperm in the ejaculation. She talked about sperm motility and abnormality. So these are some of the things that affect the factors that affect male productivity or reproduction. So she also talked about the fact that male and female infertility issues is about 50-50 right now. That usually before people feel that female infertility is usually caused by female, or but it's not. So female is about 30%, male is 30%. A combination of the two is about 20%, and 10% is unexplained. So if you have unexplained infertility, so there's nothing wrong with you, there's nothing wrong with your husband or your spouse, please go, if after you've tried for 1 year and nothing is working, please go for assisted reproduction or assisted fertility. So she explained about ovulation, and the great thing that she said about all these issues is that there are solutions, there are options, and for me it is fantastic. There are supplements you can take, sometimes there are surgeries, there are things that you can do if you have any of these underlying issues. So if you've gone to the doctor and they've said it's ovulation, you're not ovulating well, or it's just sperm, or it's your ovaries, there are solutions, there are medical solutions to help you achieve pregnancy. There are medical options that you can take to achieve pregnancy. And then she talked about, I asked her about what do I call it? Surrogacy. I talked about surrogacy and egg preservation. So if you're a woman, you're over 35 years, or you're in your 30s, you are not married, you don't know how soon you'll be married, and you're worried about having children, maybe when eventually you're married. And so what is advised is that you can do egg preservation. So you preserve your eggs, because once you're over 35, your eggs quality reduces. So there's facilities in Nigeria that you can preserve your egg, so that you're sure that you have good quality eggs when you eventually get married, no matter your age. So that's her advice. She talked about surrogacy as well. This is also happening in Nigeria, and the good news, that one of the things she talked about is that for instance, the Ministry of Health has given guidelines on surrogacy. So there's a guideline as regards how it should be done by any fertility clinic. So it's pretty safe, it's pretty okay. If that's the option that you've been given, please try it out. So bottom line, and I think the main things that I want to say is that, number one, please don't wait, don't delay. If you have delay in childbearing for anything, or you're having miscarriages, please go to the expert and get an option to help you. The longer you wait, the more difficult it becomes. What Dr. Bero said is that a lot of times couples come when it's so late, and so they need to start looking for alternatives, so it gets more expensive, it gets more complicated. But if you're able to go on time, without waiting so long, it makes the job easier, and it makes the success rates higher. So my advice to everyone is, if you are waiting couple, please go to the appropriate place. Another thing I want to say is that you can never over prepare for conception. Everything in life is about planning, and you need to plan and take the right action at the right time. So I would want to say that if you're in this condition, you can reach out to me. Very soon we're having classes, preparation classes for conception. Is a master class, and you need to read my story. You need to read my story, because I've been through it. I waited for over 10 years, and I have 2 amazing children. I've been through miscarriages, I've been through IVFs. So there's nothing that I haven't been through, as what Dr. Bero has said. So I'm doing this based on my experience, and I want to be able to help other couples to be able to achieve and be parents at the end of the day. So please follow me at The Voice Chick, and then my website is there. You can read my story. I'm going to be posting my story very soon. Read my story, and there's a solution for you in terms of helping you to prepare yourself for conception. And in everything, I'm not going to remove the God factor. God is the ultimate and the one that starts and ends beautifully well. So read my story. I think you really need to read my story, and that will tell you where to go and what to do next. Thank you all so much for joining me on this program and on this session, and I want to say all the best, and I'm hoping to have the next session very soon, and hopefully then we will have more interactions as well. So thank you, everyone. Stay safe and keep safe, and remember to follow at The Voice Chick, and remember to read my story on familyaffairsblog.com. Thank you so much, and God bless.